Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and tonight we're talking about life-saving stroke care. St. Luke's provides expert patient-centered care through their accredited and certified primary stroke centers that are nationally recognized by the American Heart Association. We'll be joined by a panel of professionals in this field, hearing patient stories of success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at life-saving stroke care at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. Meet Dr. Daniel Ackerman, the Director of Stroke and Vascular Neurology at St. Luke's University Health Network. After attending the Lewis Katz School of Medicine at Temple University, Dr. Ackerman completed his residency at Thomas Jefferson University Hospital, falling in love with neurology before he even started medical school. Dr. Ackerman, in his free time, describes himself as a family man. He has 5 children ranging from 2 to 17 years old. Sometimes he's giving driving lessons, and other times he's giving piggyback rides.
I grew up a little bit in a medical family. My mom is an ER nurse and my dad is a pharmacist, and I've always seen that as just a great opportunity to kind of help people and work with people. Here at St. Luke's, part of my role is to work with the entire stroke team at all of our network campus sites. We've been able to take a big community throughout 8 different counties in the state of Pennsylvania and moving into the state of New Jersey and create a single unified stroke network with a single stroke team. I love it at St. Luke's because I think in our area, St. Luke's has a true commitment to being in the community with our patients. This is what I love to do, getting the opportunity to care for stroke patients and to be here in this environment where we have such amazing resources to help people. St. Luke's stands out because we've been able to bring that technology to bear, not just at one main hub hospital, but really reaching all throughout the communities that we serve.
Welcome, Dr. Ackerman. Thank you for being here.
Well, thank you for the opportunity. It's such a great chance to talk to people.
Let's explain to people what exactly is a stroke, what's happening in the body when a stroke is happening.
Well, stroke really at its core is damage in the brain, and it's damage that happens because of a blood flow problem. Now, just shy of 90% of all strokes happen because of a clotting problem or a lack of blood flow. The remaining 10-13% is actually a bleeding problem, either in the brain or right next to the brain.
And I think we're going to get to it a little later in the show, some of the signs and symptoms, but it's very important with a stroke to catch it early.
Oh, absolutely. So when a stroke strikes, usually there's a core area of damage, and that area we can't fix. There's nothing we can do about that. But often there's an area of the brain that's sick but hasn't been fully damaged yet, and that's the area of brain that we hope to save. The faster a patient gets to us, the more of the brain we're able to fix and save.
Absolutely key information. Thank you, Dr. Ackerman. Joining our panel next is Dr. Martin Oselkin, an interventional neuroradiologist at St. Luke's. His practice is focused on the treatment of patients suffering from vascular disorders of the brain and spine, such as stroke and aneurysm. Dr. Oselkin also performs complex spine procedures such as ablation of tumors and epidural steroid injections. Outside of work, he enjoys playing and teaching tennis to his 2 young sons, who will hopefully make the U.S. Open one day.
In my senior year of college, I had to take some extra science classes. I took a neuroscience class, and it was the most fascinating thing ever. And at that point, I decided I was going to focus on becoming a neurosurgeon. Then I had a lecture in my second year of medical school on this field of interventional neuroradiology. So an interventional neuroradiologist is someone who treats patients with strokes and aneurysms in the acute setting on an emergency basis. St. Luke's was the first in the region to get all the special advanced imaging software that allowed us to offer more patients the treatment that at other facilities would not have been available. I'm working with my neighbors. These are friends and family. We all have a commitment to doing best for our fellow neighbors as well.
Dr. Oselkin, St. Luke's in Bethlehem is a comprehensive stroke center. Tell us why this is important and what does it mean to be a comprehensive stroke center?
It means we've been certified by a federal mandated organization that tests us for the highest patient safety standards. And multiple studies have shown that people who are suffering from strokes, they have better outcomes when they are treated at comprehensive stroke centers, such as St. Luke's.
So it's good news for us here in the Lehigh Valley that we've got this St. Luke's comprehensive care. Excellent, good. All right, let's meet our final panelist, Dr. Richard Leung, a neurohospitalist at St. Luke's University Health Network. After attending medical school at Ben Gurion University in Israel, Dr. Leung completed his residency at SUNY Downstate, followed by a fellowship at the University of Maryland. Dr. Leung believes in talking to patients and their family members to help them make decisions that are individualized for the patient. He's committed to bringing the most relevant science and resources available for neurological care with a compassionate approach to each one of his patients.
The thing that drew me to neurology is that we're just at the tip of the iceberg in terms of understanding what's going on in the brain. It's very satisfying to see a patient go from somebody who is unable to speak, unable to walk, use their limbs, to regaining function. My role is to treat patients who come to the hospital with an acute neurological problem. That could be a stroke, it could be an epilepsy exacerbation, it could be multiple sclerosis. So what makes St. Luke's unique in stroke care is that we really care for the patient from the moment that they have their symptoms up until their recovery period, from the timely identification of a stroke to treating the patient in the acute phase. St. Luke's is really an all-encompassing stroke care network.
All right, Dr. Leung, with your colleagues here, we've learned what a stroke is and why it's important to have a comprehensive stroke center. Can you tell us a little bit about what age a stroke can happen and what the risk factors are and who maybe is most at risk for experiencing a stroke?
Yes, absolutely. Well, by and large, strokes that we see are in patients who have what we call traditional vascular risk factors, things such as hypertension, diabetes, heart disease. These all expose patients to risk of having a stroke. However, patients at all ages of life, all stages of life, could experience a stroke. We do see perinatal stroke around the time of birth. We see young children who have stroke. Could be due to sickle cell disease or another, blood-borne disease. We also see young adults with stroke, and they may be exposed to it due to a clotting factor disorder, or it may be an injury to some of their arteries. They may have a defect in their heart that exposes them to the risk of a stroke. So again, what we see mostly is the aged population, but we do see patients at all stages of life experiencing stroke.
And because everyone really in some way could be at risk if it's not yourself or a loved one, we want to talk more about that coming up in our next section. Thank you all for being here. Coming up, we're going to dig deeper into what symptoms to keep an eye out for and how St. Luke's cares for their patients who've experienced a stroke. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Well, I'm 64 years old, and I've lived in the Lehigh Valley all my life. I woke up, it was just a normal Saturday morning, and then everything changed. We went to this 50th birthday party of a friend of ours, my girlfriend and I. We went to one of the cocktail tables, and there were these little chocolate favors on the table. And I tried to get the candy out with my left hand, and I couldn't feel it. The candy dropped on the ground. I went to pick it up, and I stood up and looked at my girlfriend across the table, and she said, "John, you're having a stroke." A couple of our friends immediately got on their phone and called 911. The emergency squad got there, got me in the ambulance. I can't tell you how wonderful it is to know that St. Luke's is here. Between nurses, between people who clean your room, to empty the garbage, to therapists, to doctors. Without St. Luke's, I don't think I'd be here today.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being with us today and providing us with questions, which we'll get to later in the show. Joining me is an important panel of medical professionals, Dr. Daniel Ackerman, Dr. Martin Oselkin, and Dr. Richard Leung. So we've started to discuss the basics of stroke and stroke care, but I want to give people a little bit of a better understanding of what they should be looking for. So Dr. Ackerman, a lot of us have probably heard the acronym Be Fast. What does it stand for, and what are we looking for?
Well, first, I'm so glad that Richard mentioned that stroke can happen at any age, because it turns out 10% of all strokes happen in people between the ages of 18 and 50.
Which is a pretty big number, 10%.
It's huge.
Yeah.
But whether you are 18 or 28 or 108, the symptoms of stroke can be very similar or identical. So the acronym Be Fast is something we teach patients to try and help them remember the signs and symptoms to watch out for. The B stands for balance. Does someone suddenly lose their balance or have a sense of vertigo or room spinning? The E stands for eyes. Has someone suddenly lost their vision or have double vision, or their eyes deviated, stuck looking at one side or the other? The F is face. Is someone's face fallen or drooping or asymmetric when they smile? The A is arm. Does someone have weakness in one arm or one leg, weakness on one side of the body? And the S is speech. Is someone's speech suddenly garbled or harder to understand or very confused? If any of these things come on suddenly, it could be a stroke that we're dealing with. So then the T comes in, it's time. We want to note the time the symptoms started, and it's time to call 911.
You mentioned calling 911, and Dr. Oselkin, how important is the response time and working with the EMS and the people first on the scene in the ambulance? Because by the time you see them, they've already gone through some medical care. Explain to me that relationship with the EMS and the ambulance.
Well, first I want to say that time is of the essence, and it is a cliche statement possibly, but time is brain. So getting your patients into the hospital for treatment as fast as possible is super important. And one of the things that we do at St. Luke's is we have regular training sessions with the EMS crews in the Lehigh Valley region. And we talk about updates in the field. We also talk about reform strategies on how we can facilitate the EMS crews' work as an outside provider. And we also talk about what we do once the patient arrives in the hospital, and we ask them what they can do for us as well. So we all work as a team to make the throughput very efficient.
You mentioned how important it is for that communication piece to be happening. Dr. Leung, when a patient is on their way to the hospital and they arrive, what happens when they first get there, and what information have you been given in transit?
Well, there's a lot that happens when a patient arrives in the emergency department. Typically, we're on scene waiting for the patient to arrive, and we know roughly their age, the symptoms that they have, and the time of onset. Often that's communicated through EMS to the ED to us. In addition, our key task when we're evaluating a patient in stroke is threefold. Number one, we want to make sure that this really is a stroke. That's the first question. So we check the patient for new neurological deficits, weakness, speech problems, and we consider whether or not these make sense in the setting of a stroke. The second question would be, would this patient benefit from receiving medication that will break up blood clots in their blood system? And that factors in the time of onset and whether or not they have any reasons why they can't receive this medication. And the third question will be whether we need to call other specialists in, such as our interventionalists, to perform a procedure to retrieve a clot or a thrombus from one of these arteries.
All right, so they receive this, Dr. Ackerman. Why is this so important? Why does the time matter? And what's happening in the body during those critical moments that you as physicians are most concerned with?
Well, so at the time that an artery is blocked in the brain, which is what causes the loss of blood flow that typically leads to a stroke, there is a certain area of that brain tissue that, again, may already be damaged beyond repair, but there's a larger area that we think is salvageable or savable. So we always begin, as Dr. Leung said, by checking the patient, are they really having a stroke, and making sure, are they bleeding or clotting, because as you might imagine, the treatment is a little bit different depending on which one we actually see. But going on the premise that they're clotting, which again is close to 90% of patients, really every single minute that we delay, we are losing more brain tissue. More of the brain tissue is going from being sick but not permanently damaged to permanently damaged. We think for every minute of a stroke they actually may be losing up to 2 million neurons or 2 million brain cells. And that's every minute from the time the symptoms start, not from when they call 911 or when they get to the hospital. So our whole stroke program is organized as though we're behind the 8 ball in terms of
All
time.
the time. Time matters.
Every single time.
Well, you've got some great stuff, Dr. Oselkin, that's helping you guys do your job even better. Tell me a little bit more about how you can actually generate images of the damaged brain tissue to help kind of determine treatment options. What is this called?
So we now employ a new software called CT Perfusion, and it's branded iSchema iRapid. So what it does is it is able to distinguish the amount of brain tissue that is permanently injured, that we can't do anything about, and also gives us the amount of brain tissue that is at risk. And it gives us a ratio, and it essentially calculates everything for us. And this is a pretty new innovation, and it's what I call the iPhone era of stroke treatment.
It's really amazing what you can see and what technology is allowing you guys to do from treatment option perspective. But this is not the only technology available to patients at St. Luke's, and we're going to get to more of that after the break. When we come back, we'll learn more about how St. Luke's has come to be known as a primary stroke center and additional technologies available to you. You're watching St. Luke's Health Now.
Stroke telemedicine is the capability of having the physician come to the patient over what we call the robot, where the physician is able to see the patient over the screen so that they can make sure that there is a two-way conversation. As we know, time is brain with stroke. Every minute you're losing about 2 million neurons. So in the past, the physicians actually had to drive into each campus. Now we're able to bring the physician to the patient's bedside within minutes so that we're able to care for them quicker and be able to save more brain cells. I would recommend St. Luke's to the community because of our quality of care. We care for each patient individually, and we have individualized plan of care. So no matter what issue that patient's having, we're able to help them with it.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a really interesting show tonight. We're talking about life-saving stroke care. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Daniel Ackerman, Dr. Martin Oselkin, and Dr. Richard Leung. Thank you all for being here. This has been great information on really what to look for in a stroke, who it affects, and how you attack and approach treating a stroke so quickly. We've learned time is absolutely of the essence, but we've also learned that technology is really stepping in. Dr. Leung, you guys are working on something called telestroke or stroke telemedicine. Can you tell us what that is?
That's right, Ashley. Telemedicine and telestroke is one way that we can expand our ability to evaluate and manage stroke patients at other facilities. So throughout the St. Luke's campus, we have an army of robots. They're stationed in the emergency department, and there are two-way cameras that allow us to see a patient, allow us to see what vitals are at the moment, and to really examine the patient as best as possible without physically being present. We're also able to see all of their imaging, their CAT scans, their CT angiograms through this system. And it allows us to have a better idea of what's going on with this patient at the moment so we can make informed decisions about what to do with that patient.
And I would imagine that that matters a lot because, of course, we keep talking about time. So if we're allowing technology to help us cut back on the time, that's got to be good for patients. Dr. Ackerman?
Well, I mean, St. Luke's is now 10 hospitals strong, building number 11 right now, that spans across several counties in Pennsylvania and into New Jersey. It would be impossible for any one doctor or group of doctors to be everywhere all at once. So with this two-way communication, we can see the patients and they can see us.
So great.
It's really
It
amazing.
really is amazing, innovative medicine. And I think that it's a nice offering, and it's got to be pretty unique. You know, Dr. Oselkin, how much progress has been made in stroke care? We're talking about some of these technologies, but at its core, whether it's medications, therapies, how far have we progressed, and how on the cutting edge is St. Luke's with that progression?
I would say the field has made leaps and bounds recently. Stroke used to be a life sentence, It used to be one of the leading causes of death. It is no longer one of the leading causes of death. We've made a lot of progress, whether that's from medications or prevention, but also from treatment, from when you have an actual clot identified in your brain. So what we are able to do is use a special little catheter and some wires and suck out a clot. And that relieves the obstruction and restores blood flow to the brain. We used to only be able to do that in the first few hours of a patient's symptom onset. We are now able to do that up to 24 hours. And we've been doing that since that was approved for use. So
That's
we
an
are at the
incredible
cutting edge.
advancement, really, because it does give you a little bit more time, which we keep talking about. Dr. Leung, why is a stroke so devastating, or why can it be so devastating when it comes to quality of life?
Right. So any injury to the brain, you think about what the brain does, it controls really all of our functions, our ability to speak, to understand, to comprehend, to have memories, to use our arms and walk and, use our legs and have balance. So any stroke can take away one of those functions. This can lead to serious disability, and a lot of patients that we see require a lot of supervision and a lot of help to get back on their feet after they experience a stroke.
And often many different care professionals come into play. Dr. Ackerman, how would you describe the patient care services at St. Luke's and really what makes them different?
Well, I think the patient care services at St. Luke's are best described as holistic or comprehensive. It's something that we really pride ourselves on. So from the time that a patient is admitted with a stroke, not only are they receiving diagnostics like all the testing we've been talking about and sometimes procedures to restore blood flow to the brain like what Dr. Oselkin can do, but additionally they'll receive a comprehensive evaluation by different therapy professionals ranging from physical therapy to speech therapy. They'll have an evaluation by a physical medicine and rehabilitation physician, so that's a physician who specializes in rehabilitation and in helping people to recover from serious illnesses and injuries. They're also monitored by an excellent internal medicine team that receives specific dedicated education on stroke care, so that the internal medicine team works with us to help manage their risk factors and help organize the entire picture of their medical care, and allows us as neurologists to just focus on the neurologic care that they require. And then that dovetails from the hospital out into sometimes a rehabilitation setting or back into the patient's home through the St. Luke's Visiting Nursing Association. So we really have set up a program to take care of patients from
very, very
the whole-
comprehensive.
yeah.
And it's nice for patients to know that they're cared throughout the process. Dr. Oselkin, you often see the patient, or they may not even see you because you're in there doing a procedure, but when they follow up with you, what kind of feedback do you receive about that continuum of care of services that they've gotten through the process?
Well, I've heard lots of compliments, and not to pat ourselves on the backs or anything
I'll
like
pat
that.
you on the
But thank you. I definitely feel that people are really happy with the St. Luke's care. I've never really experienced that in all my other previous places of training and employment. And I'm really proud of what we've been doing here. I think we are giving our best from every step of the way, from the moment that they are seen outside the hospital, from when they hit the ER, after their care, in the rehab, of course, and at home. Our follow-up, our treatment for our stroke patients doesn't stop once they leave the hospital.
This is such good news for St. Luke's and, of course, for our entire region. Thank you so much for such a great, engaging conversation. Up next, we'll take questions from our studio audience. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our amazing panelists. We've had a really good conversation about stroke care and what to look for and what's provided at St. Luke's. Now we're going to take some questions from our viewers. All right, Dr. Ackerman, the next question I think is for you. Is there any support for patients and their families after experiencing a stroke beyond that of healthcare?
Absolutely. So there are actually several different groups organized throughout the Lehigh Valley. One that's actually organized by St. Luke's is called the Atlas Group, or Acceptance to Life After Stroke. So they meet one Tuesday evening every month. It's a free group, and it's an opportunity for patients and family members and anyone who's concerned about stroke to come and learn all sorts of different things. We often have physician speakers, we have refreshments, and we've taught lessons ranging from what are the signs and symptoms of stroke to intimacy after stroke. I mean, you name it, it really runs the course.
And as we've learned from some of the patient stories, there is so much more to this than just the physical. So it's nice to know that St. Luke's offers that. All right, Dr. Oselkin, if someone has had a stroke, what are their chances of having another one, and do they need to be more concerned?
Well, you're increased risk for another stroke for sure. But one of the things that we do in the hospital is we try to identify what those risk factors were that led to your first stroke. And at that point, we could give you medications to help prevent things. Sometimes these are blood thinners, such as Coumadin, that is a very well-known medication. Sometimes it is treating your high blood pressure. But definitely, even once we treat all of those risk factors, you're definitely at an increased risk. But it doesn't have to be a significantly increased risk, and many people don't ever experience a second stroke.
All right, Dr. Leung, this question I think you can answer. Is there anything a patient can do to reduce their risk of stroke?
Living a generally healthy lifestyle is probably the best thing to do. Getting regular exercise, having good nutrition, smoking cessation is a very important thing that many patients can do to reduce the risk of stroke.
Certainly. So diet, exercise, stop smoking, pretty much something you hear across the board for good health. Important to remember. All right, we have one last question here. Dr. Ackerman, I think this is best for you. What type of therapy does a patient go through after stroke, and what kind of coordinated services are available?
Well, actually, Ashley, that's a great question. The thing about a stroke is it strikes like lightning, but the recovery from a stroke can sometimes be anywhere from 6 months out to even a year or two. And because, as Dr. Leung said, a stroke can affect any system in the body, we have to have an entire range of therapies that are offered. So that can include physical and occupational and speech therapy. St. Luke's has a wonderful fitness to drive testing program that we use to try and help determine if and when patients can get back on the road. Sometimes the early time frame after a stroke is the most important. And so St. Luke's has acute rehab centers in several locations across the valley where a patient may go directly after their hospitalization to do inpatient therapy and exercise. I'd like to go there myself sometime. I could use the extra help.
It's an incredible, incredible program. It is so comprehensive. We are very fortunate to have the three of you here with us and giving us so much great information on what's available to stroke patients and their families at St. Luke's. Thank you all so much for being here. For more information on stroke care at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember it's important to focus on your health now.